And welcome back to Doctors on Call on 95.5 WSB, a weekly show dedicated to helping you live a healthier and happier life. I'm your host, Belinda Skelton. Good health leads to a good life, folks, but finding medical advice that is free and trustworthy is challenging. That's exactly why 95.5 WSB and the incredible team at Northside Hospital have come together to bring you this show. We're providing real doctors and real answers to your questions. Today, we have in the studio Dr. Stephen Tugbiyele. Joining us, Dr. Tugbiyele is a specialist in female pelvic medicine and reconstructive surgeries. And we're taking your call at 404-872-0750. That's 404-872-0750. So, Dr. Tugbiyele, how about we go to the phone lines?
Absolutely.
All right. Let's talk to Monique. Monique, you're on 95.5 WSB. How are you?
All right. Good morning. Good morning. Interesting this call would be happening as I was recently diagnosed with a prolapsed bladder just last week.
Oh.
The question is, as a breast cancer survivor who's had all of the tubes and ovaries, things like that removed, kind of has nowhere to go. Can I do do you recommend going just to surgery, or is that therapy, will it benefit me?
That's a good question. So really, so Monique, because it sounds like you've had a hysterectomy, your uterus was removed, and what can happen is the top of the vagina and the bladder can prolapse towards the opening of the vagina. Now, it really depends on to what degree the prolapse is, because we grade prolapse a bit depending on how far down it's come. For example, when the prolapse is halfway in the vagina, we say it's a grade 1. When it's at the opening to the vagina, it's a grade 2. When the prolapse crosses and protrudes past the opening to the vagina, for the most part, it's a grade 3. And when it's all wanging out, it's a grade 4. And believe it or not, I've had patients where it's all hanging out. Yeah. And so it's gravity, right, has its effect. So I would say we do something, and not doing anything is a recipe for it getting worse. So when it's a grade 1, women can benefit from pelvic floor physical therapy, Monique, because it hasn't reached the opening to the vagina yet, and the symptoms are mild, and it can physical therapy, getting the muscle stronger, can help it regress a little bit, maybe get better. However, at the point where it's a grade 2 and it's at the opening to the vagina or more protruding, it's unlikely for pelvic floor physical therapy to make the bulge go away. Now, it can help with the pressure, the having to lean forward to empty your bladder. It can help with some of the discomfort, back pain, lower abdominal discomfort that comes with prolapse and pressure, but it won't make the bulge go away. It's not, pelvic floor physical therapy is not going to defy the laws of gravity and make it go back up, is what I tell patients.
Right.
So at that point, then there are other options. Now, some women choose a pessary. Like I mentioned before, it's a device that is a ring device that goes in the vagina. It's fitted. Women can learn how to remove it, clean it, put it back themselves. And that can be one way that women treat this. Some women like that option if they're not interested in surgery. Some women prefer not to have a pessary that they have to clean, remove, and it's more work. For intimacy, it has to be removed, put back. And so some women at that point would choose a surgery, and they're good, safe options and solutions. It can be either a vaginal procedure where the incisions are hidden in the vagina to help to resupport the blood in the vagina using a woman's natural tissues. And then it could, or it could be a robotic or laparoscopic procedure for women who have more severe prolapse, and maybe their tissues are not strong enough and they need a higher lift, and that we do laparoscopically or robotically. Again, through tiny incisions, so not a big C-section cut. So either way, both options are minimally invasive. They're very effective. Women, the healing time is short. Women can resume their usual activities in a very quick period of time. The discomfort is minimal. Blood loss is minimal. Pain, discomfort. So there's so many benefits to surgery if it comes to surgery. No one wakes up in the morning and says, I want to have surgery. Right. But if it looks like that's the best next option, then for sure, fixing is better than leaving it be for it to get worse, only to cause more issues.
Right.
Hope
that
answers your
was
question.
a great answer. Yes, you did, and I really appreciate the conversation today. Thank you.
My pleasure.